This is Irvin coming to you from Resilience Occupational Therapy. In a previous video, we discussed gender affirmation top surgeries, and you can check out that. That's when someone has had their breast removed to affirm their gender. And this video, I'm going to get into some of the specific self-care massage techniques that somebody can do to help integrate that scar. I have here a bolster, which we're going to use as a simulation of the scars that we're talking about. So you have a longitudinal scar which would be going across here, and we're going to be simulating that here so that you have a general sense of how I work with the tissue. Obviously, this is much more symmetrical and geometric, even if we were to give a curve to it, than the contour of anyone's chest will be. But I thought for this video that this would be a good enough explanation. So when you're doing self-massage, it is important for you to be doing everything gentle. None of this should hurt. Things might feel stuck or a little bit weird, but none of the work that you do when you're doing this work or this scar work or chest scar work should be painful. Sharon Wheeler, the rolfer who I learned this from, really developed this technique as a very gentle approach. It's not about breaking up tissue. You can check out the other video for more explanation on that, but from just a safety standpoint, just go slowly and gently. And there should be no problem with gently exploring your scars, because your pain response is there to tell you if something is not right. And you shouldn't be anywhere close to that as far as something being painful. So as I said before, we'll be using this bolster here as the model of the longitudinal scar. Now, often there's two separate scars going across the chest. Sometimes they connect around the sternum, but usually not. And the first technique that I want to show is what I refer to as dusting, or feather light dusting. And if you're doing this on yourself, I'll sort of demonstrate it myself first. I'm bracing the tissue away from the scar and brushing towards the scar. So on the bolster, you'll see that if I brace here and I'm brushing towards the scar, just gently exploring it. So I'm just giving a little bit of tautness to the tissue, so it's not just sagging with it, and gently moving towards the incision site. And the idea is it's feather light dusting. It should just be dusting and sort of thinking about that image that you're dusting across it. So if you're working on this on yourself, you might just have one finger or a couple of fingers, and you're just working across the scar. Once you do it on one side, you can go to the other side and brush across the scar towards the midline of the tissue. You're not crossing the incision site, not that you can't work right up to it, because the idea is not to be spreading the scar incision, but to be dusting up to it. The next technique I do is really a version of the feather light dusting, but it's more detailed. Instead of doing big broad strokes towards the scar, you're coming right up against the scar and doing almost a little bit more combing against it. So again, this is not the best model for this, because the nature of this doesn't have all the fibers and such that you might have in your scar. But when you're working, you're going right up against the edge and you're sort of combing out. Now, this is not patterns that you're imposing like I might be demonstrating here, because this is contrived and is sort of this just flat surface. You're really exploring the contours of your individual scar. And while you're doing that, gently sort of combing it out, finding those little spots that seem a little bit more stuck, and just exploring them a little bit and combing through. Again, you're not passing the middle line of the scar. You're coming up to it and maybe getting to the middle, but you're not pushing over the middle, because the goal is to just be combing it out. Sometimes imagine it like if this is a horse's tail, you might be combing on one side and you might be combing on the other, but you're not going against the tail itself. So the other technique I like is what is referred to as delete key. And the pressure of delete key is if you had a full keyboard, not the one on your laptop, that had that extra click to it when you push down, being able to push on the key up to the point where you feel that resistance but are not actually clicking it. And ideally, when I'm doing the work, I've got my hands across the entirety of someone's scar, and I'm feeling well, not the entirety of the scar, but for a good amount. And I'm thinking of this is another technique referred to as playing the piano, where you're doing delete keys across it. But here, you're finding a hard spot, and you're looking for where's the hardest spot, and you just do a little delete to that, and then you feel to the next hardest spot, and you do a little delete to that, and it's even lighter than I'm showing because, as I said, it's just a gentle tap. So if you do that, when I do it as playing the piano, I've got my fingers across the length of the scar, and I'm feeling into this, and I find, okay, right here might be the hardest spot, and now here's the hardest spot, and you're just going for those lowest hanging fruits, and when it's sped up, it can look like you're playing the piano. Practically speaking, if you're doing that for yourself, it's hard to play the piano here. But what you can do is with one hand, take your work across your scar and be like, okay, this is a hard spot. Let's push into that and explore it a little bit. We're not digging in. We're just gently tapping the hardest spot. And that seems to, just by having that exploratory delete key gently tapping, seems to help smooth out the scar. And that can really help. The last technique I want to leave you with in this video is one that has to do with thinking about not just the superficial scar itself, but how it's relating to and tying to other tissues. Because that's usually where the problem is. The scar is pulling when you try to raise your arm, or it's kind of getting stuck on itself, and there's might be some discomfort. And that's the main reason why we're working the scar. These techniques are not going to make your scar disappear. I don't think that should be your goal. The scar is something that shows that you've had this work done, and is not necessarily a bad thing. But when you're exploring the tissue, you've got that feeling of the feather-like dusting and the smaller combing and then the delete key. And now you can kind of sink into the tissue and work on it, thinking about, and if you can see in the case of my shirt, if you imagine that as the skin or the scar, you're sinking into the tissue and then moving around a little bit and seeing where is it stuck. If it's stuck somewhere, then you explore that a little bit. You're not yanking on it, but you're exploring that tissue and going, it can't move that way. Can it move a little bit above or below that? And you're just giving a little bit of traction and tension to that skin. If it were a rubber band, you'd be pulling on that rubber band and just doing this to it, even though you could take the rubber band and do out to here and snap it. You're just giving the tiniest bit of the beginning of the elasticity of that. So you're working that and you're just gently exploring it. There's not these big yanking motions. All of these techniques are useful and safe for you exploring your own scar. If you want a little bit more help, my clinic is there for that. Thank you for listening. If you have any questions, please feel free to reach out. We're going to be doing other videos exploring how your posture relates to your scars, as well as some things around the emotions that come with the top surgery.